Hello everyone, welcome to another edition of Microbiotics BioTalk. How are you? It's been a while. Hope you've not missed me too much because I have actually missed you. Okay, I've not been in the studio for a while, and I've been busy, of course, attending to other science communication activity for microbiotics, and of course I attended an event. I covered an event on behalf of microbiotics recently. So the feedback from the event is what I'll be presenting in the studio for the next few weeks, so that you guys would have an idea of what I've been up to, and because the information is actually very important to you as well. So this evening we'll be talking about the National Strategic Health Development Plan, which I learned recently from the annual operational plans of the State Ministry of Health and Human Services for 2024 that I attended last week. And during that period, I came across this National Strategic Health Development Plan, and I was actually very surprised because it was also new to me, but I was able to catch up and get a lot of information about it, which I'll be sharing with you, and we should be talking about in the next few weeks. So, the NSHDP National Strategic Health Development Plan was initiated in 2010, and the first plan that was made was to cover the year 2010 to 2015. And the reason for the creation of the NSHDP was because of the poor health indicators that we have for Nigeria, which was among the worst in the whole world. And Nigeria alone, as at then, showed that about 10% of the global disease burden. And it's actually a big issue, and a big issue in the country, which made the health system extremely very weak. So because of this, the federal government of Nigeria back then, through the Federal Ministry of Health, under the leadership of Professor Oyebushe Shuku, came up with a purposeful reform for the national health delivery care system to help strengthen the weak and fragile health care delivery system and improve its performance. And they eventually came up with a national strategic health development plan. This development plan is actually more of an overarching framework for health development in Nigeria, because it draws inspiration from the 36 states and the FCT health development plans. Each state had their own development plan, and then it was put together to form the national development plan. And it covered 8 strategic priority areas, which include leadership and governance for health, health service delivery, human resources for health, financing for health, national health management information system, partnership for health, community participation and ownership, and finally research for health. So the first version was actually initiated in 2010, like I said, to cover for the year 2010 to 2015. Of course, it was effective in some areas, and the success recorded were actually impressive. They were actually impressive, and some of these achievements included the domestication of primary health care under a one roof policy. Before I go ahead, let me quickly break it down a little bit. The National Health, National Strategic Development Plan, it was, after its design, was to be taken to each state and adopted and domesticated according to each state needs and their capacity. Of course, the states, the needs of each of the 36 states are different from one another. So by the time each state is taken into cognizance the development plans being made, they're going to adopt it and domesticate it to suit where they need actually a lot of attention. So the priority areas, although they are actually important to all the states, but we have a different level of priorities among priorities. I think you understand that. So back to the achievement that was being made back then under the first NSHDP. Of course, I've already mentioned the domestication, and another thing that was being achieved was the basic health care provision funds for universal health coverage and the successful launch of the national health policy. We also have increased investment in procurement and distribution of some preventive materials, some disease preventive materials, and we have innovative programs such as the midwifery service scheme and the free maternal health, maternal and child health policy, which actually contributed to reduction in the maternal and neonatal death and mortality in Nigeria. So this actually were the achievements and a lot more. But of course, unfortunately, because it's the first should I call it the first development plan being made. The development plans being made, of course, there are some challenges that made it absolutely necessary to upgrade to the second developmental plans. These challenges included political will, gaps in political will. A lot of state governments find it difficult to actually adopt and domesticate some of this because of the lack of political will. And then there's poor program ownership at lower level. Some of these plans were rejected at the communities, especially at the LGAs. They were rejected, LGAs and the communities, the local communities. It's very easy to make rules at the top, and then if you are not going to carry along the communities, they are going to say no. And then, of course, we have a lot of problem with coordination of donors who are ready to actually give a donation to finance health. We have issues about their coordination. They are not well coordinated. And then, of course, there are also issues with the harmonization of development and technical assistance from outside or even from within. We have low level of government financing of healthcare at all three levels of government, and there was a weak monitoring and evaluation system to actually follow up with the implementation of these developmental plans. So, based on this, the development of the second developmental plan was absolutely necessary, but it did not commence as scheduled, and because of this, it took much longer, and the plan was only finalized in 2018. So the 2018 to 2022 developmental plan formed the second NSHDP that we have, and this time around it actually covered more than the original priority areas. The original priority areas for the first developmental plan were just 8. The priority areas were just 8, but this time around the priority areas were increased to 14 to cover a lot of occurrences. Of course, when the first one was done, let me just give an instance. 2010, there were no Ebola outbreak back then. So Ebola outbreak happened in 2014. So when the second one was being made, it's actually take into cognizance the possibility of epidemic actually happening, and definitely it happened in 2020, COVID. So you can see the importance of this upgrades. So let me quickly read out the new priority areas for this second developmental plan. We have leadership and governance. We have partnership for health. We have health financing, which is actually very important. We have priority areas that deals with communicable disease and even non-communicable diseases. And we have the public health emergency preparedness and response that came as definitely as a fallout of the Ebola crisis. And then we have human resources for health. We have health infrastructure. We have general and emergency hospital services. We have health promotion and social determinant of health. We have health information system. We have also research for health. Then, due to the issues that happened in the ownership of those programs that were being domesticated, we now have community participation and ownership again this time around as a single priority area. Then we have reproductive, maternal, newborn, child, adolescent health services and nutrition. And finally, we have medicine, vaccine, and other health technologies and supplies. So these are the new priority areas, and over the incoming week, we'll be discussing more about these priority areas. We'll be taking them one by one. Hopefully, if we cannot do BioTalk on them, we'll be doing some writings on them. We'll be giving you, information as we normally do now. So, and if my plan also work, we'll be bringing in professionals whose area of concentration are this area as well. So we'll be bringing them in so that they'll be able to have good conversations around all these areas and tell us how our health is being managed in Nigeria. So let me stop here. Let me wish everyone a nice day ahead of them. The week is just starting, and I hope that all you guys enjoy your week. So I'll be looking forward to interacting more with you during the week. We'll be talking, we'll be bringing in people, and we'll be writing. So make sure that you stay safe and definitely have a lovely day, lovely week ahead, and also have a beautiful September, and make sure that you stay safe throughout the rest of the year. Bye.